Hey everyone, I'm Tim, the owner of Natural Forces Massage. Thanks again for watching this video. Today I wanted to go over how to, for couples, like, people at home, kind of like a massage for dummies type thing. Not calling you guys dummies, don't worry, but how to help a frozen shoulder. Now, what is a frozen shoulder? Well, if you really want to know what a frozen shoulder is, how quick to find out is if you can't do this, some people have a problem when they start going up, it starts hurting right around this section. They can't go backwards, they can't go up, she's obviously good. But what can cause frozen shoulder sometimes, if they have, forward head posture really, really bad, like she kind of does, but so she could possibly get it one day, but we're going to prevent that because she works here at a massage therapy clinic, to help, so when this does that, go forward with your head. We get a little hump right here. You can't see because of her hair, but it can kind of pinch on the nerve, which would stop the movement. Now, we're going to work today on, you have muscles that go through this joint, and they get caught through here whenever it gets real tight and the nerve gets pinched. So today I'm going to show you some techniques y'all can do at home, some kind of easy things doing on each other. Just kind of, if you are doing this, make sure you're careful and don't hurt each other, and don't do it when you're angry with each other. So just hang on tight. All right, now that she's on the table. Oh, by the way, in case y'all don't know, this is Lauren. She's a great volunteer for us. So for this sake, we're gonna pretend that this is the arm that has the issue. So what I try to do as a therapist, now, if you really want this worked out, you should probably come see us, or if you're watching this video and you're not from the Atascocita, Texas area, see a neuromuscular massage therapist. Just look that up on Google and you might find. But how we're going to do it is, if you are in the area, you should probably come and see us. So, anyways, what I like to do, some of the first things that I like to target, we talked about the neck, and we also talked about the shoulder through here. It causes a lot of pain. So a lot of the times I want to do is I want to release some of the pectoral muscle. I want to release this, under the armpit muscles. Basically, it's called your subscapularis, but don't worry about that. Just make sure when you press into these areas, ease in, because they can be pretty tender. We're going to be hitting some good trigger points. So first things first, you're going to hold them like this. If they can't get up here, just kind of adjust right here. But, usually frozen shoulder stops about here. So I like to hold them like here. And I'm going to get into the pectoral muscle. Now you're going to feel a little tendon right here. Can you see Ashlyn? Ashlyn's our videographer. Right in here, you'll feel it kind of hops. You want to get right on that hop and just kind of rotate. You can have them resist the movement a little bit too. So like I'll go here and she'll push, okay, that way or the other way, it doesn't matter, because I'm holding you down. So, and this is a good active release for the area. If it's too much pressure, they can tell you. I don't want anything over a 7, from 1 to 10. This is really just to get the edge off, and, you should probably see a professional for the full treatment, but if it's really bugging you, nerves are hurting really bad, it'd be good to do that. So, also next, we're going to try to get this subscapularis muscle. So, it's right under the armpit, right in here. What I like to do, as a therapist, we may use our fingers because we know the exact point to hit, but since y'all may not, I'm going to put my full forearm in there. So I figure you get the whole thing in there, then you're guaranteed to hit the spot. So, so like I said, they can't move. So we're right here, and you see the redness right here. It shows that there's already some good blood flow going into there. Now, I'm going to try to put my forearm up under and sink straight down, not straight towards the rib cage, and you'll know that if you're hitting the rib cage because they'll probably want to hit you. So just try to get right onto the armpit area and sink onto the shoulder blade. Do you feel that? Okay. Now you shouldn't go sink straight into the armpit as far as this section. This is not a good area to go into. That's way too much stuff going on in there. We want to get this area, right in here. This is what we're aiming for. Can you see? Okay, so again, I can even go a little bit lower and get the bottom part of the shoulder blade. Yep, they love it, see? You'll know that your massage therapists are a little bit sadistic, but only because we care about people and can help them.
Ouch.
Yep. All right, so you notice, and go to the point of resistance, you know. Someone can't go further than this, so stop there. If they can, go here. Next, now of course, we're gonna do a couple other techniques. I like to do is, you're good and covered, don't worry. She was worried she didn't shave, so, you know, she's like, did you just mention that to on YouTube? That's okay. Like I said, a good fist, you know, straight into that muscle. A lot of, definitely females, they have a lot of tension in this area just because they carry a little bit more in the front than guys do. A lot of therapists don't work on this area when they should, you know, obviously with permission from the client. See, just like that, a little bit of passive movement. All right. Next we're going to do, before I turn them on her side, all I really want to do is show y'all some good stretching for the neck. You can see some good neck stretches on my other videos, but you get right under here, put them on the top of your forearm, and right about here. So you'll see their head is now on there, and I put my hand on the collarbone a little bit. Don't put too much weight in there. Turn and tilt. Get a good stretch. Feel that? Good. This kind of releases the pressure from the nerve. All right, good. And then you can do both sides just to kind of even them up. She tends to help me a lot more than I want her to, but that's okay. She's just a helpful person. So another thing you can do is you can grip under their occipital ridge, which is that bony landmark, or their skull. Kind of grip and hold and pull. Push down on the top, pulling the back. That's a good traction move. It generally feels pretty good. It's also really good for headaches. Good. All right. The next step, I'm going to have you come around here. Actually, I'm a geographer, so come around here. And go and turn on your right side, Lauren. That's this side. We're still not doing it right. You're good. Go ahead. Turn. All right. So she's laying on her shoulder. Probably not a good idea. So we're going to extend here. There we go. And I'm going to have her bring your arm up and over. There you go. Stay in front of the camera just in case. I got you covered. Don't worry. So what I like to do now, and this is a really good technique, and maybe even have them with a pillow under their neck. I'm just not that nice to go get a pillow right now. But what you're going to do is sink them into your elbow and hold their hand. Next, get a little lotion. You can get, if you don't have lotion, you can always use coconut oil or something like that. Relax your head. And I like to get a little lotion, put it on there. And now grip in this general area. And even people that don't have frozen shoulder, a little bit tender in there. And if you do, you're probably even more tender. You're going to just kind of push forward with your hand as you pull backwards with the other hand. So just like that. It's actually usually feels pretty good. A little tender, but kind of a good pain. See how it's kind of releasing the tension in that joint, allowing for more movement. Now, go to their point of resistance. So they can't go further, kind of doing there. You know, you notice I'm using the pad of my fingers. I'm not digging in with the tips. All right. That usually feels pretty good, like I said. What we can do now is we'll do the opposite with this thumb. I'm going to do the opposite now, the opposite movement. The idea is you're working the entire joint out. So along this bone, working through there, getting the pressure off. All right, you can even go with your arm, go across. Yeah. If she had a nice pillow, she'd be so much more comfortable. But she's a great volunteer, like I said. All right, next, the last thing we're going to teach you is it's a supraspinatus release. The supraspinatus is usually the muscle that's causing the impingement, the frozen shoulder. So what it does, what I'm trying to do is, if you feel these bones, you're going to feel one that aligns here and at here, just like that. It's a little triangle. You want to kind of press right here. The way to just make sure you're not on bone. Use your thumb, put your other thumb on top of that thumb, and just lean. It can be real sensitive. Is that pretty sensitive? See, I'm barely pressing. And then you'll have them bring their arm up. There, stop there, while maintaining the pressure. And then return your wrist in and out. See, she is good at following directions. And put it back down. Up. And this is the last one. And down. So do a little bit of all that repetition and they should start to feel better. We thank you again for watching these videos. Please subscribe to our YouTube channel and tell us what you think on the comments. We're also on Instagram and Facebook if you'd like to follow us. Thank you again.